Doctor, what are the risks of internal bleeding in children with hemophilia?
So it's hemophilia kids have higher risk of bleeding in the joint uh, joints, like they could have bleeding in the elbow or knees. They have those kind of bleeding. Internal bleeding, organ bleeding is also at risk if they have severe hemophilia, where they are not producing any proteins, which is really responsible for stopping the bleeding, like factor VIII. So if they have severe hemophilia and severe factor VIII deficiency, they could have internal bleeding. That risk is lower, but still exist. So again, it's important to know if they have hemophilia or not. Once you know they have hemophilia, it's important to know whether they have severe, moderate, or mild hemophilia. Patients with mild or moderate hemophilia have lesser risk of internal bleeding, but patients with severe hemophilia could have a higher risk of internal bleeding, and they may benefit from scheduled or prophylactic doses of the medications to prevent those kind of bleeding. So they could really be managed that way, in a different way. The bleeding we worry about is the bleeding in the tummy, where there are muscle bleeding, or there could be bleeding in the brain, which could be devastating. So it's important to know the degree of